Would you like to get rid of those fine lines in your face? I want to share with you treatments that are working in just one treatment. Hi, I'm Dr. Michael Cutler at SDIM and Spa. And patients often come in and they ask, hey, can we do a little Botox, not just in the creases of my forehead or the glabella region or around the eyes, but can you put it in the lower face and make those wrinkles go away as well? And I need to explain to them, hey, this is not something that are muscles, where muscles can be paralyzed with botulinum toxin. This is an area that takes other treatments, but the fastest and most effective treatment really is to use a certain kind of hyaluronic acid, HA filler. Dermal fillers are used in soft tissue. They can be used for changing the shape of the cheek or the nose, the jaw, or the chin, but they can also be placed different kinds in the skin and to help fill in those finer, small wrinkles where botulinum toxin doesn't work. So I'm going to share with you my two favorite fillers for that. A very soft filler, I call it, Bilateral Balance. Another one that's not so soft but gives more of a lift, and I use this Restyle and Lift for the nasal labial fold area, because that area often creases right in to the commissure, this crease that goes around the edge of the mouth, and there are often other creases. Sometimes right above the lip there's a deep crease, or down under here below the lower lip there's a deep crease. And so to use this kind of filler with a tiny needle called 30 gauge needle. It's a very tiny needle, a little bit larger than the one I use to place botulinum toxin, but with some very powerful topical numbing cream in preparation. The injection points are really not very painful unless we get into that upper area or into the lip. As you know, lip filler, any of you have had lip filler. Using this kind of filler is a very delicate kind of procedure where I place it just into the dermis and just below the dermis in these areas. I've even filled in acne pockets, acne scar pockets, or creases that just can't be fixed with other kinds of therapies such as vampire facial or topical creams or chemical peels. Those things just won't take those deeper dermal creases away, but filler can fill them in. And how long does it last? Typically, it's going to last a year, sometimes 2 years, depending on how quickly it's metabolized. Filler placed in the lip will often burn out because we've got a lot of muscle in there. So you got a lot of blood flow and your body will metabolize that HA, hyaluronic acid filler, as it is its own natural. It recognizes it as a natural ingredient in collagen in our skin. But when it's placed in an area where there's not a lot of movement or blood flow, it can last longer. And it's funny because patients will look at this changes, what they get right after the procedure, and they even get a better result 2 weeks later when your body takes that filler and sort of incorporates it into the tissue around there, and you get healing from any bruising that can occur, and the hyperemia or redness of the skin from the injection sites go away. So when you see pictures, typically, if it's a true unaltered or doctored up picture of you before and after, you should see some redness in the area where the injection was done. So that's how you'll see, and the change of the creases there with dermal filler is wonderful because it's immediate. Patients walk out quite happy looking at the change that they get from that treatment.